Okay, my bad. What's good, Bo? What's happening? Hello, everybody. My bad. I messed up. We back. Get Cola back on here. We'll finish where we started. I gotta make sure she get back on here. So, Cola, I don't have you on here. Cool. There we go. I think. There she go. All right.
There
All
we
right.
go. All right.
What's up?
Record time, right?
My my record setting patient. Lost 17 and a half. What's going on? How's life going, mama?
Oh
Hey,
shit.
it's
uh, wait, hold on one second, cause I had turned the move the light, and it'd be a lot going on to be the behind the scenes. Okay. All right. I think we good now. All right. So yeah, life.
AQ. If you look in, it's supposed to be. There's a lady who like I consulted with that has actually got a story kind of similar to yours that is from Atlanta, Florida, XYZ. She has got a whole bunch of questions about Maya making me and stuff too. So if she hop on here, if she's here, I might pull you on so she can ask you some questions. But my bad. Keep going.
Oh no, you good. So life has been really good. 2 years post op. Um, Life has been amazing. If I can't say it enough, not living with fibroids. I feel like, to be perfectly honest, sometimes I feel like I look different. Like when I look at pictures, um, it's like, especially like I know nobody else could see this, but I could see pictures and I'd be like, I was on my cycle in this picture. Like I can tell, like I see it all in my face, and it's just like I feel a lot different. Like that's why I be telling the world, like everybody deserves relief, however they choose to obtain it. But we definitely, and it takes it, like it takes a lot of bravery to sometimes face it. So that's why I like to share. All right, so welcome back. Um, we had to take a baby
Yeah.
break, so we back. And
Good.
again, if you want to ask a question tonight, I have some that I submitted. You can drop a question in the question bubble with the question mark. I think I'll be able to see them. And also, you can request to join, and then you can get like a free consultation on the spot. So where did we left off? We were talking about endometriosis not being. Is it why is it so difficult to diagnose? Did you finish
Yeah,
that one?
I pretty much finished that. It's the quick and dirty of it is it's just sometimes the implants are not there to see visually. But more importantly, like, it can present with a lot of other things. Like people have just heavy, painful periods. They have other things that are happening, maybe constipation, diarrhea. They have things that are just happening that can cloud the picture of endometriosis. So, but the quick and dirty way, again, like I was saying, is hormones, a trial of hormone suppressants. If you decrease the amount of hormone that the ovary is producing and your symptoms get better, then endometriosis is the default diagnosis, right? So that's how someone can figure out if you have it without cutting on you.
Mm-hmm.
Just 3 month trial of a birth control or hormone suppressant and see if things get better. Even if they're marginally better, the chances of you having endometriosis are very high.
All right. Well, it looked like it's still asking me, do I want to say send a question to you when I click the question bubble? So I still got. Let me go through some of the submitted, and then I'll try to catch what's on the screen.
Appreciate it,
Or
Rod.
if you click the question box, what does it show for you?
Uh, question mark is, um, nah, I see. We got a couple questions. So, do fibroids delay menopause from starting? Answer to that is no. Fibroids are their own entity. Menopause is strictly related to your ovaries and how your ovaries are producing hormone. Um, it doesn't progress menopause. It doesn't delay menopause, right? So you can have, fibroids and have normal periods and have, I got patients that are still having regular periods in their 50s and have fibroids. So it doesn't really dictate anything as far as fibroids are concerned. The other question um, was how accurate is excessive surgery? It depends on how skilled you are, right? So, the thing that I try to like talk to Hologic as a whole, and why I teach so much is because it can be very inaccurate if you don't know what you're doing, right? There are two different screens for excessive. It's a 2D screen and the 3D screen. It takes a lot of understanding and a lot of uh, just practicing the skills to get that 3D screen. The 3D screen allows you to pinpoint exactly where the fibroids are at to be able to treat them. If you don't understand how to use that 3D screen and you're just going in there using the 2D screen, chances are you could be burning uterine tissue and doing harm. So, that's a question to ask. Like, how comfortable is your surgeon, understanding that 3D screen? Understanding that 3D screen is extremely important. So, the accuracy of Excessa, which is laparoscopic radiofrequency ablation, which is a treatment of fibroid. It's a minimally invasive treatment of fibroids. You got any questions about it? Go back in my timeline. You see Excessa. I put it in there, show what it is, show what it looks like. You go to accessaprocedure.com and get more information on it. But the accuracy of it is how the skill of your surgeon, plain and simple. And then how long did the 304 fibroid case take? Ooh, that was like, I want to say 6.5 hours, between 6 to 7 hours that took me.
Wow,
But to me, it's like,
you up there
you
with
know,
me.
yeah, to that point, it was like, well, why would you do that? Why would you keep a patient on the table? Why would you do that? Why wouldn't you just take the fibroids out that, were just there, just leave the rest of them? Because I am blessed and cursed with the the desire to always do the right thing. I can't half-ass anything. I can't, like, if you know me, when I do something, I'm going to do it. If I'm committed to doing it, I have to do it. It's innate in me to do it to the best of my ability. Even if I don't want to do it, like I just cannot do that. So if I go in somebody and I'm like, God damn, why you got all these fibroids? Which I did, right? I take a deep breath and just say, I'm committed to this woman to do what I said I'm going to do, and I'm going to do it. And I don't care how long it's gonna take me. I have to do what I said I'm gonna do. So my mama raised me. That's just how I am. That's just it, which is to the benefit of all my patients, to the detriment of me because I miss stuff, I'm late for stuff, I'm doing stuff because I'm just OCD when it comes down to completing things that I start.
Hmm.
So yes, it took an excessively long time. I guarantee you it's 99, 95, 99% of doctors that would have said, you know what, these little 2 millimeter fibroids, they don't matter, right? And it may not, but they may not grow in the future, whatever. But I just don't believe in it. I believe in getting every single fibroid, no matter what, how long it takes you, no matter how many it is. Stay my black ass in there and get them out because that's what I promised her that I was going to do. So that was that. Took a long time, but I'm happy that and confident and satisfied to the point where she's fibroid free. She don't have to worry about it. She's never coming back for bad fibroid disease in the future because I got them all. That's that.
Right. And
Um,
that's
good.
what you want, that type of commitment. Okay, I got one. I'm gonna switch to me.
Go
I
ahead.
had an open myomectomy in August. My doctor said she removed all of the fibroids. I had a total of four. She has now suggested an IUD to decrease the risk of them returning until I am ready to conceive, but I am concerned about the hormones. What is your opinion?
IUD to reduce the risk of fibroids returning.
That's what it says.
I disagree with that. IUD is going to help with the bleeding. It's not going to necessarily reduce any risk of your fibroids returning. So I think that's misinformation. Um, you know, it does help with hormone suppression, but it doesn't necessarily say, hey, if you keep an IUD in after this, you just won't get fibroids back or they will get bad. That's not true. It will help with the bleeding though.
And it
Um,
will be birth control
it's
if you're
birth
not supposed to get
control.
pregnant with
Absolutely, that part. Do fibroids cause heavier periods? If so, what? If so, is that enough of a reason to have them removed? So this is the behind the curtains, right? So if your doctor says, "Hey, I'm gonna treat your fibroids and your bleeding is just gonna magically get better. It's automatically gonna get better," they're lying to you, right? I never say that to any patient because the truth of the matter is that can fibroids cause you to have excessive contribute to excessive bleeding? Absolutely, it can. However, their bleeding or heavy bleeding can be mutually exclusive to fibroids, meaning that two things can be true at the same time. You have bad fibroids, but you also have very heavy menstrual cycles, meaning that if I go in there and remove your fibroids, you could still have very heavy menstrual cycles with no fibroids. So somebody promising you that your bleeding is going to be normal as soon as you take your fibroids out is incorrect. Now, what I will say is if you have fibroids that are significantly impacting the cavity or pushing into the cavity, the chances of you, if you remove those, the chances of your bleeding improving are extremely high. It will improve, but you still may have heavier periods than what you are supposed to have because physiologically that's what your body just does. So then answer to your question, which I hope I am answering your question, um, if you have fibroids that are pushing into the cavity, it's absolutely worth addressing those, removing, treating, or doing what you need to do for those if you have heavy bleeding, but keeping realistic expectations to understand that they may not be the only sole source of your bleeding. You may have abnormal uterine bleeding in addition to fibroids. You remove the fibroids, you treat the fibroids, you preserve the uterus. If your desire for having children, preserving your uterus is high, you take the risk of still having some heavy periods or maybe some issues with your uterus. But that's that. Just be realistic about treatment options and what surgery is going to do for you as far as it relates to your fibroids.
All right, this question, I can see some on the screen. This one says, what is the telltale sign that you have fibroids?
Um, there's not a telltale sign. I honestly, um, an ultrasound will tell you if you have significant fibroids because, like I said, you can't really say bleeding because it's not always bleeding. You got bleeding with fibroids, you got bleeding without fibroids. You can sometimes feel them. Like if you feel a hardness or protrusion of your belly that wasn't there before, that's now there, that is a telltale sign. But everybody doesn't have that. Some people have smaller fibroids, so don't do that. Some people have larger fibroids, and that is the first time you feel it when you press on your belly and you feel this hard mass. If you have pain with sex and your partner is feeling something hard going in your vagina, or you put your finger up there and it's something just like a lump or something feeling in there, that's a fibroid, not your cervix. Understand what your cervix is, understand a fibroid. Cervix is spongy type. It's like a little knob, like a knob on a doorknob. That's what your cervix feels like. A fibroid is a hard rock-like mass. You put your finger in there and you feel like a big rock pushing in there, and it feels like that pressing in. That's a fibroid. So it can be. So you can feel fibroids. You can have, symptoms like pain with sex, frequency of urination, pain pressing or pushing down to feel hard on your belly. Those are signs, but again, those are not always telltale because you can have fibroids that don't cause those things. It doesn't mean that you don't have fibroids if you don't experience those things.
Um, how does one stop fibroids from growing back post myomectomy?
Very good. So um, there there are a lot of different things that are said. There's enough to be said about lifestyle changes and modifications, right? Which is why I partner with Coach Jesse as far as like her supplements and the things that she's promoting for inflammation and healthy wellness and those things because, I can't I can't say that um, anything one thing says, all right, that's for sure key to not have fibroids come back, right? But what I can say is that overall, healthier living, what we put in our bodies, how we live our lives dictates a lot of our health issues, right? So hypertension, diabetes, even growth of certain things and what have you, if you are putting better things in your body, then the chances of those of recurrence of fibroids has to be reduced. In addition to getting all the damn fibroids, right? You got to make sure if you go into a surgeon, they don't just get the ones that they think are problematic. They get all of them. So I get all fibroids. And with that being said, I don't. I have not personally experienced a patient that's had an extensive myomectomy that I've done come back with fibroid disease. But I would definitely recommend, you know, looking at healthier living, and looking at a regimen of diet, nutrition, and exercise as you have had a myomectomy to help reduce inflammation, reduce recurrence, or what have you. So, Coach Jesse is a huge advocate of it. I support her in that endeavor. That's why I tell my patients like, hey, if you're not eating right, you're not doing the right things, whatever. She has a regimen. Definitely can talk to her about it. But if you don't even want that, healthy living, uh, diet and exercise is my advice to you.
All right. Um, you want to go or you want me to go?
Keep going. You
Okay.
you you roll.
All right. This question actually is for me. Um, Cola, what complications did you experience post-op? Um, so I don't really, okay, so I do have one complication, but it was
you
self-inflicted. Why are you
talking about
laughing,
you talking about the booty thing? What you talking about?
Dr.
Yeah.
Yes, I
So
am.
so
So, just regular post surgery, I was good. I had very was like at by my incision sites, but that's like the first 1 to 2 days after the procedure. I mean, you've been jerking around. I did get scratched up on my butt too. But what I would say my biggest complication, self inflicted, because Dr. P scratched up my butt, was not listening.
pause. Clarify that. Because
Okay, the stabilization pad, the
pause.
stabilization pad scratched up my butt. So it almost got like a rug burn from the motion of pulling it. I don't know. I mean, was like a rug burn?
Yeah, it's like a rubber. So with robotic surgery, you have to like put a patient on like their head. Like you have to uh, tilt the table so that the bow and everything goes this way, so you can actually see in the pelvis or what have you. When you have like long surgeries, like she had, like you start sliding, and your ass may slide on this pad that's going on there. So she had little rug burns on her ass when she walked. And I haven't even seen this shit. I haven't. She's like unique to this happening, but she had little rug burns on her ass because she was sliding up the thing like slowly and slowly, so it just caused little ass burns. But that's okay. So we
Yeah, so I
gotta.
woke up like my ass is on fire. I remember that. And the nurse was like, and I'll never forget, the nurse was
Oh
looking
shit.
like, I think she's dreaming about something. And then they looked and was like, oh, and she scraped up. And they was like, go get some gauze. So but
Oh
I would say the
shit.
most, if I had to pinpoint a true complication, I would say it was self-inflicted because when you get discharged and Dr. Johnson gives you prescriptions, one of the prescriptions that he gives you is stool softeners. And in my mind, never went to medical school, but think I know my body. I'm like, I don't know what he gave me them for. I drink a gallon of water a day. I eat a pretty clean diet. I'm very regular. So I ended up with a hemorrhoid. And of course, when I went for my well woman's visit and I tried to explain this to the resident, they wanted to have when they normally look like landscaping rocks. So I did that to myself. But that would be my any advice is that if they give you stool softeners, take them, and don't get the over the counter. Get the prescription version that they give you and just take it till it's gone. Because I guess, what is your body resetting itself? Because I definitely, like I said, I drink plenty of water. I eat pretty clean, so I'm very regular. I don't have
Yeah.
issues with going.
So somebody tried to, is one to hop on here with us, so that's
But that question is for you.
what.
Is it resetting? I said, is it because you reset yourself? Like, why do you need the stool softeners? Because you prescribe.
A couple of different reasons. Number one, your bowels are slowed down with anesthesia. Number two, usually patients are taking iron, so iron uh, firms up the stool too, which makes it more difficult to pass through. Um, and narcotics. So narcotic pain medication also slow the bowels. So that's three different things that are happening that causes you to become more and more constipated. And yeah, so that's why I give stool softeners.
Okay. So yeah, that's so I didn't listen. So if they give it to you, please listen. Like I said, that would be my biggest one because I like I did that to myself, and I mean I'm okay now, but it's still like, she come back,
Yeah,
whatever.
I'm gonna ask this person.
All right.
So I tried to. I don't know why it's not accepting me, but I tried to accept you, um, Mina. It's not being very friendly today with accepting people.
Yeah,
I
it
tried
was
to accept
tripping
you too.
letting me in, and I'm
Yeah,
the co-host.
I try. I tried. I'm trying to accept her, but all right. Until it accepts her, let me read a couple more of these
Okay.
other things. Blah blah. Dang, it's a lot of questions in here.
Yep.
Having a tubal ligation affect where you cut? No, it does not. Not at all. It does not affect where I cut at all. Um, is it safe to have fibroid surgery after three C-sections? It's yes. I mean, when you say safe, is relative. Is there more risk associated with myomectomies after having uh, C-sections or open surgeries? Absolutely. It's usually more difficult because of the scar tissue, but can it be done? Absolutely. Just performed that on a patient that had two myomectomies last week. So yeah, it can be done. I will caution you. You definitely need to do your research because you can get messed up real easy, real quick if you've had extensive adhesions and somebody's going in there trying to do a myomectomy or a hysterectomy. Like adhesions can cause major complications if you in the wrong hand. So be very careful. Do fibroids cause heavy appearance? No, I answered that question. Um, do fibroids make us have cycles past your middle 50s? No, not typically. Like if you have extensive fibroid disease where fibroids are pushing into the cavity, which you should know well before 50, yeah, it can prolong periods some, but typically no. Menopause is menopause. It's not that fibroids are going to make you now have periods to you 60. It doesn't really work like that. What's the best insurance for out of state patients trying to come to me for a myomectomy? PPO plans for sure. I default to Blue Cross Blue Shield because they have the most plans and usually have the most flexibility. Um, they usually have the most flexibility as far as you know where you can go and what's covered or whatever. But there are multiple different insurance companies. But PPO plans typically let you travel outside of the state. Um, HMO plans keep you confined because the insurances contract with a specific group of doctors and they decrease the payments out or whatever. They control costs with more so with HMOs. Not to say HMOs are bad. I have an HMO myself. So it's not that it's bad, but when you want to travel and have the freedom with your insurance to do whatever the hell you want to do, it's more expensive. Those are the PPO plans. So you could just call your insurance company and just, see calls. I would start with Blue Cross. Blue Cross, you don't like what Blue Cross is saying? There are Cignas, Aetna, there are all types of different insurance agencies to ask. And then the last question that was on here, and then we can go to the other part, I think,
Yeah, I got
is
some still too.
how long or too late after myomectomy is it too late to try for pregnancy after 35? So 35 is this magical number of, and let me tell you something before I even say that. If you hear somebody say geriatric pregnancy, as a OBGYN, walk out that goddamn office. And I'm gonna say this. I'm gonna say this. I don't care. Because I saw this on TV and I've seen this like professionals say this shit. And it's horrible. Don't like there's nothing in our textbooks that says anything about geriatric pregnancy. There's nothing that says that. Geriatrics are for old people, right? If you are in reproductive age, you're not geriatric, right? I deliver 36, 37, 40, 41, 42, 43-year-old women that get pregnant, have healthy babies. It is not a thing that when you become 35, you're gonna have a mutant baby and just or you can't get pregnant. That's not the case. So take this term geriatric pregnancy and boot it to the heavens. It is the worst shit to tell anybody. Will never tell any woman that. With that being said, does the complication risk or the risk of pregnancy or whatever slightly increase every year after 35? Absolutely. The older you get, the more there are risks. That's why, yeah, quote unquote, high risk or whatever. But it does not mean that you cannot get pregnant, or if you have I do a majority of the patients that I honestly that I do myomectomies on are between 37 and 43. Honestly, women that are have careers that are later in life that have put off surgeries that are doing all of the type of stuff that want to have children later in life and they want to preserve their uterus. Never will I ever tell them that no, I'm gonna do this, but you have no chance of getting pregnant, or I won't do it because you don't have any chance of getting pregnant. That is garbage. If a doctor tells you that, get your ass up, walk out of their office, go get a second opinion. I feel very passionate about that. Obviously, y'all see what I'm saying, but I don't like when people are told misinformation or told things that don't make any damn sense, right? And that doesn't make any sense. Like, talk to people that know what the hell they're talking about. Reproductive endocrinologists or fertility doctors will tell you, your chances. Let them talk to you and tell you your chances. 35 is not the cutoff for that. Okay.
All right. One of the questions in the screen: should every woman check for fibroids?
No, absolutely not. Don't be checking for fibroids. Don't go looking for fibroids. Let your body tell you. If you start feeling something hard in your belly, then yeah, go see about it. If you start feeling, having abnormal periods or pain or anything else, um, you know, then yeah, go see about it. But don't just start getting serial ultrasounds. You go to your annual appointment. Hey, I just want an ultrasound just to see if I have fibroids. No, you're gonna drive yourself crazy, drive yourself up the wall. Don't do that. I do not recommend doing that with anybody. Same way when you have fibroid surgery, going to do serial ultrasounds or what have you doesn't make any sense. Treat symptoms, right? If you start to have symptoms or other issues or questions, then you do it. Other than that, no. Um, so let me try to see if I can get this girl on.
All right.
It's not doing it though. I tried. I tried. Mina Bearcan. I tried. It's not. It's not letting. It's can't do it. I tried. Go to the next question. I don't know why it's not letting people come on.
Yeah, that's. I'm telling you, they did something, and then it'll be back right next week.
Hmm.
Because it's like it's letting me scroll on the screen. It usually don't let me do that.
Right.
Now
I
this
don't
week
know
I
what's
can
happening.
scroll on the screen. I recently heard about scars from myomectomy fusing to your muscles. Is this accurate thing? I definitely have a dent in my surgery area. I had surgery years ago. Is there anything I can do?
I'll have to see it to answer that question. Yeah, scar tissue is a real thing. Scar tissue happens. It forms anytime you have surgery or you injure anything in the body. As it heals, it forms scars. That's what happens. Um, but is that scar tissue pushing into your scar or whatever you? I have no idea. I'd have to see it. Um, but usually, excuse me, scars or indentations or whatever, they can be corrected. Um, So it just really, someone that knows what they're doing can like see it to correct it. But yeah, scar tissue is one of those things. You have to be very, very meticulous with surgery. You have to put things back appropriate and how they're supposed to be placed back, to decrease the formation of scar tissue. A lot of people don't do that. So when you talk to your surgeon, you ask them how meticulous you are with scar tissue and what's your philosophies about preventing scar tissues and how you do it. If they're like, oh, I don't want to talk about that, then you need a second opinion.
All right, another viewer question. What is the recommended procedure to treat inurable and submucosal fibroids?
What's the what treatment?
Well, they spelled it
No,
IN.
I got that part. I know what they're trying to ask, but
What is
what's
the
the
recommended procedure to treat the intramural
in
and
the
sub?
neural, so in the muscle
Okay,
submucosal. So
sub.
there's no one treatment, right? There's no one treatment to be able to treat those things. Like there are options. It really depends on what, how big, where they're at, whatever. Just will dictate what your options look like and what makes the most sense for you.
For
Um,
size, they put 2.5 up to 8.5 centimeters. And I know you still say it's still multiple, it's still position matters too, but they did put the size in there.
my bad.
Okay, because you was frozen, frozen.
My bad. My bad. Okay, what's the next one?
Uh, uh, oh no, no. Okay. So somebody was saying, is it frozen? Okay. What are the signs and symptoms of bladder prolapse? Um, and the causes, and is it more likely to happen after a hysterectomy?
It's not more likely to happen after hysterectomy. If it's going to happen, it happens. There are multiple different factors into bladder prolapse or any type of prolapse of the vagina, which include genetics, smoking history, weight. If you're obese or morbidly obese for years, that increases the risk. People that have chronic lifting jobs like postal workers, weightlifters, people like that that consistently strain and put stress on the pelvic floor. Those people are higher prone. Smokers, the genetics. If other people have had, collagen disorders or prolapse in your family, that increase your risk. So though it's multifactorial, meaning it's not just one thing that causes it. It's multiple different things as far as if you have it or not.
Yeah, the
Um,
signs and symptoms.
do you feel tissue protruding into your vagina? Do you see it? Do you feel it? Those are really signs to say it. I mean, there's no other way. Some women with horrible bladder prolapse will have urinary changes. Some women with rectal prolapse will have chronic constipation, or they have to push up. You got to push up in order to pee, or you got to push up in your vagina in order to have a bowel movement. That's a prolapse problem. But usually it's when tissue starts to prolapse down into your vagina. You can see it, feel it, problems with sex, painful. Those are signs and symptoms that you may have a prolapse issue.
And what are some possible treatment options if
Not a lot.
diagnosed?
It depends. There are several surgical options depending on how bad the prolapse is. If it's not significantly impacting your quality of life, you don't necessarily have to do anything. You can live with prolapse if you can have sex with it. It's not painful. You have regular, normal activities, and you don't necessarily have to do anything. Um, but pessary, right? The older you are, you're not really worried about sex or don't really want surgery. Space filling objects, pessaries are space filling objects that you place in the vagina that basically re-support or support uh, your vagina, almost like a brace or a crutch for your vagina, if you will, where you don't have to have surgery. But other than that, if it's extensive, then it's surgery.
All
So
right, this question is for me. Cola, you had a hysterectomy. Did you have to go to physical therapy after surgery? I'm assuming you mean pelvic floor therapy. It says physical, but no, I did not need any therapy. Um, there are many myths out there that if you have a hysterectomy, other parts of your body will shift around. And I'm not saying it never happens. I'm saying there are many myths that hysterectomy equals all these bad side effects. I, as again, only side effect I got is landscaping rocks from not taking the stool softeners. And that's my fault. Okay?
man, don't make
That's
me man, don't make me spit this goddamn water out.
it. That's it. I might scare the wax lady a little bit, but that's it. That's it. That's it. So I'm not like I didn't have to go to any therapy. My case didn't require it. I'll say that. My case didn't require it. Do you have any feedback on that?
You won't need therapy after. Right? If you had pelvic floor problems before surgery, if it's not corrected during surgery, you're going to have pelvic floor problems. But it's not like, oh, you remove the uterus, now your vagina is falling out. That's not how it works. It's not. It's been studied extensively as far as does removing the cervix, the uterus, whatever, increase your risk for um, pelvic floor issues? And the answer to that is no. Right? It used to do super cervical hysterectomies, keep the cervix because they thought it did. It's been studied extensively. That is not true. If you're going to have pelvic floor issues, it's because you're going to have pelvic floor issues. It's not because you had a hysterectomy.
Excuse
I
me.
got I got time for a couple more. Then I gotta
Okay.
I gotta I gotta bounce. We'll do another one. We won't wait for a
Yeah, I'm
whole month. We
sorry it
could
took so long, y'all. I
yeah
was in a leadership class at work, so
yeah
it's winding down. Should be done by November.
we could run this back next week.
You got the question, or you want me to give you
No,
one?
I don't have. I answered all of the ones in the bubble.
Okay. All right, I got another one.
Let's
And I
see
think
this
this
one.
one I think we talked about it before, but remember it played us last time. Why do you need to have a C-section after a myomectomy? I get that one a lot.
Got you. Very simple. All
And I
right.
think it got
So
cut off last time.
got you.
So,
This is the answer. Right. So your uterus is like a house. Right. Let's look at it like that. Your uterus is like a house. Imagine, and I'm gonna use this. I just came up with this analogy. Imagine that you have a big storm that happens, right? A big storm like a category 5 hurricane, um, earthquake, or whatever, and you got this house sitting there. The category 5 hurricane or what have you is like pregnancy. Okay, myomectomies are like removing multiple bricks out of that house. Now, if I remove 50 bricks from the base of that house and this category 5 hurricane comes through, the likelihood of that house falling increases because I've removed the bricks from the house, right? When you have a myomectomy, you're removing large masses out of the uterus and repairing them structurally. Though you repair it and it heals, you still have defects in the normal architecture of the uterus. So now, with those defects, you put a 6, 7, 8 pound baby in there to stretch it all the way out, and now you're going to push 100 pounds of pressure to push this kid through a hole this big. And what you're expecting is that kid, that 6, 7, 8 pound kid, is going to fit through that hole before the house explodes because one of those bricks is out of place. The chances of the house exploding or your uterus exploding or uterine rupture is 4 to 6% after myomectomy and delivering vaginally. I told you right now, if you got into your car and it's a 4 to 6% chance that you would not make it home from work, I guarantee you, you take a bus or have somebody else get you home. You would not drive that car. If I told you right now that it's a 4 to 6% chance that if you get to an airplane and you fly to go see your friend, go kick it or whatever, it's a 4 to 6% chance that you don't make it, you're not getting on that plane. So there's no way on God's green earth that if there's a 4 to 6% chance that your uterus will rupture and you die and your baby die, that I'm going to let you, or any doctor that values their livelihood or their life is going to allow you to push and have that possibly happen. Can you deliver vaginally? You may well can, but nobody's going to take that type of risk. You have a significant risk of losing your life or your baby losing your life, which is why after a myomectomy, no matter how they recommend it's like if it's not extensive, it's not going into the uterus or whatever. Who's going to judge that? I got to go off somebody else's word that it didn't get. They may not know anatomy. As soon as I see myomectomy, we having a C-section, right? And that goes for most other OBGYNs. They're not playing that game unless they did it themselves and can say, hey, yeah, she just had serosal fibroids that were just really on the top or the outside of the uterus. Didn't have to do much to take it out, just kind of plucked it off. That's like I'm taking a brick off the chimney and not a brick and out of the foundation. Huge difference. But that's the reason why. I can't give no better analogy than that as far as why you need to have a C-section after myomectomy, as opposed to do a vaginal delivery. Hope that helps. I just came up with that analogy, by the way, but that's the best I can give.
That was a good analogy.
All right,
It was
awesome.
very, very
All
thorough.
right, good. We
All
got we
right.
got to say that one because I like that one. Because anytime
Okay.
somebody asks, we got to say that one. That's a good one.
Yeah. Yeah, that's why I said I couldn't say, well, let me send it to you on the last one because I think we lost it. But I get that question definitely a lot. So, you want to end on that note?
We'll do one
Okay.
more.
You want to take it out the viewer screen?
I don't even think it's yeah. We could do it the viewer screen and everybody. Sorry. Um, when and where did you cross? I crossed follow one Xi Sigma Xavier University of Louisiana. That's a random question, but that's it. Yes, I
I
did
get
pledge.
those
Pledge.
two.
I pledged for real. Like undergrad, went through it. Yes, all of that. Have myomectomy. How long after myomectomy can you work out? You can work out. You just can't lift heavy. You can't lift. Well, no, you can't. For myomectomies, it just really depends on how extensive it is, right? You still have an incision. That varies. It just really depends on how the incision was done. I usually tell my patients you can do aerobic stuff, but no ab work if there's an incision for at least a month. No heavy lifting for at least a month. Um, that's that. There's some questions in here. Um, no, that was the only extra one. You got another one?
Uh, well, you know, we gonna be here all night. That's why I said I do
Forever.
one.
Yeah,
So
screenshot
you have
them.
a patient in here that said that she definitely loves you. You are the best damn doctor ever,
Appreciate
in all
it.
capital letters.
Appreciate it.
I agree. I agree. And
Thank you.
I'm very, very, very well. I've shared my journey. I definitely interview other physicians, but I definitely picked the right one. He the
Thank you.
only one that would have got me on the table, and I desperately needed
Thank
to
you.
be on the table.
Leave a review. All these trolls, I done got trolled to death. People, I
And
have
we didn't
patients call me
report
like,
them.
"Oh man,
We didn't
I
try to
read
report
Google.
them, and then they
I
keep.
know you're a good guy, but the Google reviews, like man, it's a whole bunch of people that never met me for a day in their goddamn life, and say, oh, he's this, he's that, he's that. Take his license, kill him. Yeah, like I got death threats because I said people should just go to the best surgeon. So whatever the fuck you want to say, but please leave if you had surgery and you love me or whatever, leave a review because I got so many trolls that killed my health grades, killed my Google review. I don't really care at the end of the day because it doesn't really bother me. Like people that know me and people will see what I do. What's a Google review to somebody who's had
If anybody knows how
right,
Google works too, it's not
right. You
fair.
can do
Like
whatever you
unless
want.
you're paying for like their subscriptions and
Right.
stuff like that, because
Yeah.
trust me, we as the P-Hive Nation, we have definitely tried to report some of those ones where we can tell they just don't like your TikTok, which is not a
At all.
reason. And
At all.
Google will be like, it wasn't any harm done, and they leave it
Right.
up. But if
Fuck
you
'em.
pay, oh, they'll take it down.
Yeah, fuck
So
'em. Look,
everything,
fuck
everything.
'em. But all right, get any questions that we didn't get, and we can reconvene and do this um
Yeah,
next
well,
week
I
sometime.
know. So you got to tell them right before you go. Tell them about everything that you're doing next week, because I would be there if I
Awesome.
wasn't remodeling the
Awesome.
house.
So look,
I would be there.
so and I'm about to get on because so we can really we're in the final phases of our app launch, making our tweaks and doing all of those things. But I'm so very excited. Pulse of Perseverance is, what I do outside of medicine. Like I'm worried about people. Like, do you teach kids? Are you trying to bring like I am? I'm all about inspiration. I'm all about mentorship or whatever, and I want to see more Dr. P's get into these spaces. Pulse of Perseverance is a nonprofit organization I started with two of my best friends. That's destined to change the narrative and shift the culture and try to get these kids in the spaces of success. If you can't see it, you can't achieve it. If kids don't see me or they don't see lawyers, doctors, they don't see engineers, pilots, or they don't see these things. They don't know that those things are out there. So the app in of itself is designed to provide access for kids like myself. That was a kid one time looking for answers for mentorship. Uh, it's revolutionizing mentorship so that people that are busy, like myself, like you, Cola, like everybody that's busy, don't have really time. You got time to get on your phone and put a post a story for Instagram, Facebook. You can have time to post what you do for a living, what's going on, or whatever, and touch thousands of kids and have those kids be able to reach out and ask questions or whatever. And even if you don't have the time for that, we have people that are on the app that'll help be able to facilitate and answer questions even when you don't have time. And then also the app is designed to get the ecosystems for those kids to form strong bonds of community to push each other, to propel each other, and to help each other, support each other. So that's what it is. It's the P3 app, Pulse of Perseverance. We're holding our fundraiser next week in New Orleans on November the 3rd. If you're there, if you're in New Orleans, homecoming, Xavier is great. All my Xavierites, like, support us, like, come out. If you're not, just come on out if you can. If not, just support us financially. Whatever you can give, I don't care what it is, it's helping the cause. We've put a lot of money, every dollar that we've made from our book proceeds or whatever, we put it all back. We haven't taken one dime from it. We've given out monthly scholarships since 2018, $1,000 a month. Do the math. Like we've been putting the work, putting the money out. Every dollar we get, we push it back. So all your donations, it ain't going to my pockets. It's going to these kids. So if you have it in your heart, www.pulseof3.org/events, which I'll put in here. Um,
And the link is in your bio,
it's in my
right?
it's in my bio. But you like, I don't see the link. No, so I'm gonna get it right here.
Yeah, I was gonna
Um,
say it's there because I reshared it a couple of times. It's there.
yeah. So, but I appreciate everybody.
I think
For
it's
everything,
an
for the support.
amazing initiative, and a lot of times people do the talking, but you and your friends are actually doing the work. So this is so amazing, and
Mm,
y'all have every reason to be very proud. I haven't been to New Orleans in like 5 years,
mm.
so trust me, if they wasn't tearing my house up right now, we would be there. Me and Sean
So,
would definitely
and
be
we
in
we're
New
gonna
Orleans.
the next thing we're gonna be doing is in Chicago. So we doing big things. So we'll need mentors. We reach it. We're gonna have mentees that come on. It's gonna be really big, very exciting. We've been working on it for over a year. It's really dope what we trying to put out. So please support us. As far as me, Fibroid Slayer, I got movement on this show. It's coming. It's coming. It's coming. Like I already got the people that are actually understand how important what I'm doing and getting it out to the masses and helping women on a larger scale. So that whole fibroid slayer thing or whatever, it's getting into the right hands. It's taking some time, but it's getting where it needs to get. So please stay tuned with that. I did not release it on YouTube because I was told really not to do that with networks or what have you. So, but things are happening. So you'll hear a lot more about that very soon. But thank y'all for tuning in. We're gonna do this next week, run this back,
Well, next
get
week
these
is
questions.
you
Oh, it
got to
is.
be ready for.
That's all right. We'll figure it out. If not next week, the week
Okay.
after,
Yeah, I was
we'll
gonna say
figure it out.
I'll still connect with you and see what your time, but just remember next week is your big
Yeah,
launch
that's the big
or
thing. Yeah.
whatever.
So next week might be tough. So we'll do the week after.
Okay.
All right.
And yes, I'm glad you addressed the show because that was
That's
definitely a
the biggest
question
thing.
that I get.
I ain't listen.
But
I'm
I
on it.
always
Like I'm
tell him,
having
I said,
meetings.
well, you said it
Yeah.
earlier tonight. When
Yeah.
P say he gonna do something,
I'm gonna do it.
he
I'm
gonna
gonna
do
do it.
it.
I'm gonna
And
do
the P-Hive is real. So all the people that was in here, they was cheering P-Hive, P-Hive. Yes, that is
it.
real. So it's plenty. I'm not the only patient. I'm 2 years ago, but I'm still a patient. But I've committed to doing this because I was so overwhelmed by how many people had the same story I did. And definitely because of his gift, I think a lot of people deserve the relief that I obtained.
And with all my patients, all you guys, like I'm formulating like the emails, the blast or whatever, because I do want to form like that whole community where we do like a fibroid led community where people can come in and ask questions and get um, you know, the support for fibroids and other gynecologic issues. So I'm starting that too.
Absolutely. So many good things coming.
All right.
We definitely appreciate
All right,
you.
people.
I definitely appreciate everybody who joined, and we will see you next time.
Yeah.
Thank
Till
you.
next time. All right,
All right.
y'all. Love.
Bye.